Now, this is 2010, and I mentioned that this is a countdown to 2015. Now, we have come a long way. I'll use the Malawi example. 3,000 patients ever started on treatment in 2003. 2010, over 211,000 alive on treatment. So what we are doing now is we've given hope to all these people, 211,000, that HIV is a chronic disease just like hypertension, just like diabetes, just like asthma. So it means once you're on treatment, you are going to be alive just like another person. So with the support from the Global Fund, these people have like a hope to say that I'm going to live, and this is actually a fact. The other component is that the health systems have been developed whereby now you are able to even manage other diseases properly, because the diseases come together with these. So this is a time whereby you don't want, I remember when I was yesterday when we were talking with other people to say that even actually the president of the US, Barack Obama, in one of the rallies mentioned about the Americans do not quit. So this 2010 is not also the time whereby you need to quit on supporting the people who have HIV, those who have AIDS, because it is the time to support them even more. And what I'm looking at is I will put in an analogy, like an explanation, to say that when you are in Malawi, you are talking over 211,000 on treatment, but around the globe, you are talking over 4 million people who are on treatment. Now, what I wanted to mention is that, assuming that you are crossing the dark area, so it's in the darkness, underground, and there's a tunnel. One leads to the ocean, the other one leads to the mountain, and the other one actually leads to a land which we call a promised land. And there's actually a torch which is shining. So we have these 211,000 people from Malawi walking in the tunnel, and they're able to see that light at the end of the tunnel, which is a torch. So the torch is an analogy whereby the torch has batteries. So when the batteries are there, when they're being charged, it means you're able to see the light. So people can walk and go as far as where they're going to reach because there's a light at the end. But assuming that the batteries have gone off, so it means that the light has extinguished. Once the light has extinguished, then the people who saw the light are not going to be able to see, so they are not going to see anything. So then their hope is diminished. So I use the tunnel analogy to say that the Global Fund is a torch, which the batteries have to be recharged all the time to make sure that the people who have hope are able to see that. If you don't recharge the batteries, then the people will actually not have hope. So it is also, we're talking about replenishing the Global Fund in order to make sure that the people who are seeing the light at the end of the tunnel are going to continue to say that we have hope, we are going to live, and they can also contribute productively to their nations. So even countries which are poor, but actually they might contribute, and then we might say there's a small and progressive economic growth. So this is the time, 2010, as we're counting down, as I mentioned about the linkage of the Global Fund to the Millennium Development Goals. So as you're moving towards that, it means that you should be able to make sure that you can actually contribute to support the achievement of the Millennium Development Goals with actually the Global Fund replenishment. So that's what I've mentioned to say that this is the time. We have come a long way, and we have made a lot of progress, and we should continue to make that progress forever. Coming from Malawi, I do appreciate the contribution which has been made by the American people through the Global Fund. As you know that $1 into the Global Fund, $2 is matched from the other partner. So that's championship by the American people. Also through the PEPFAR, there's been a contribution also to different countries. And although Malawi is not a PEPFAR-focused country, but actually through the we have actually funding which has been coming through into Malawi through the Centers Disease Control and Prevention, through the USAID, and also now it is through the partnership framework which has just been signed by the American people and the government of Malawi. And also in other countries, in the resource-limited countries, there have been a contribution from the American people. So the message I would say is that the American people have been a champion in order to make sure that they contribute towards, and through the Global Health Initiative, which has just been established, you see that what I would say is that the U.S. administration can be able to show the world, to say that we do care and we have come a long way, and there is actually to make a long-term commitment to say that if we put in a long-term commitment within the Global Fund, for example, there's been a lobby to make sure that the U.S. administration could put in $6 billion US over a period of 3 years. That is money which is available in there. If that commitment is done, globally, the other countries also would take that as an example. So you're setting up an example to say that we do care and we will continue to contribute. So the message which I would put forward is that the American people, through the U.S. administration, can actually not go back, but forge ahead and say, we will continue to contribute to the Global Fund, and we will have long-term commitment. Then what is going to happen now is that the other development partners would actually come along, and also we would know that in the achievement of the Millennium Development Goals, the American people have been forefront to do that. And also for the Global Health Initiative to achieve its goals, contribution through the Global Fund would also be another way of doing it. So the American people have always been caring, and I know that they will continue to be caring. So wherever people are, what I would expect is that there are people who can actually stand up and lobby for long-term commitment. There are people who are people to write about the situation, as I've explained, to say before the Global Fund, countries were really had devastating situations. After the Global Fund, you can see a lot of hope from the people who have been on treatment. So the issue is that let's talk about it, let's lobby about it, and then wherever we are, we can continue to lobby to make sure that the U.S. administration champions the contribution towards the Global Fund in order to leverage the support which is available globally. So that's what I would say. Let's join hands. And one thing which I like about the Americans is working together as a nation. So I would like actually to applaud that also. So I would like to make sure that we utilize that momentum. And this year, 2010, as we are counting down to 2015, couldn't have been a better time to do that. The Lighthouse treats 13,000 people currently who are alive on treatment. And if you compare that with 211,000 people for Malawi, and I'm saying these are dependent on the Global Fund. They treat the antiretroviral therapy which are provided in Malawi are from the Global Fund. If the Global Fund is not replenished, these people would die. That's what is going to happen, because Malawi as a government, although it has a contribution towards the HIV programs, there's no way it can cope with 211,000 people on treatment. So just in brief, I can just say, without the Global Fund, the people will die.